Good afternoon and welcome to Health in Focus. This is Dr. Laura and I'm dealing with part 3, the final part of Alzheimer's disease. Now, interestingly, on the news today, I think it was Gordon and Lorna who did our mornings this morning, and there was an article about statins, the tablets that people take to lower their cholesterol, being useful actually to prevent Alzheimer's, and hopefully, by the grace of God, I shall get to that stage where we talk about prevention of Alzheimer's. But as you know, Alzheimer's disease is a disease that affects people mainly over the age of 65. It is an age-related disease. It's more common in women than men, and there are the risk factors involved, which I shall talk about shortly. This is live today, so you can interact with me at live@revelationtv.com. Today I'm going to be concentrating on the symptoms and signs of Alzheimer's and tips for carers as well, how carers who have to cope with people who suffer from Alzheimer's, how they can cope with the obvious mental deterioration and decline in both mental as well as physical function of their loved ones. It is a sad subject, but there is hope. There is always hope, because we have a God who loves us. We have a God who gives us clues. I mean, God is so wonderful. I love watching Dr. Grady McMurtry because he's so knowledgeable about science and creation and stuff. And it's amazing how we know the little bit that God has given us, the knowledge that he's given us is so, so amazing. So even though as yet there has been no cure for Alzheimer's, we know there are things we can do to prevent it so far. We also know there are drugs that can slow down the process. And in the news today, one of those drugs happened to be statins. Now, statins do have their bad rep, but one of the risk factors for Alzheimer's is heart disease. So it's not surprising that a high cholesterol, which can lead to heart disease, the drug that's used to lower cholesterol is also a preventative drug for Alzheimer's. But very quickly, let us just go through Alzheimer's disease. Alzheimer's is caused by the formation of plaques and tangles in the brain cells. These are plaques and tangles in the main brain cells. So that's what happens. Plaques and tangles are formed in the brain cells. These plaques are beta amyloid plaques, which build up between the junctions of the brain's nerve cells, where the nerve cells are connecting to each other through synaptic junctions. These beta amyloid plaques settle in between the nerves, therefore disrupting the function of transmission of information from one nerve cell to the other. And in addition, inside the actual DNA of the nerve cells, there are tangles, which are twisted tau fibers, which build up inside the cells, completely disrupting the function, the replication, the restoration, all the normal functions in the cells, causing them to be disrupted, causing them to break down, and eventually killing the brain cells. Now, Alzheimer's is the most common cause of dementia in the UK, and it accounts for 80% of those who have been diagnosed with dementia. There are over 500,000 people in the UK who suffer from Alzheimer's, and as I've said, it affects the over 65s. It's a progressive disease. In other words, it gets worse and worse and worse, and we still need to be praying about finding something that's going to nip this thing in the bud and stop it progressing. But as yet, we have some clues, and praise God to that. So what are the stages of Alzheimer's? Very briefly, in the early stages, there's mild memory loss, there's confusion, poor judgment and apathy. In the mid stages, there's loss of cognition, problem solving, personality changes, personal information goes, then they become poor in self-care, they socially withdraw. Then in the final stages, there's loss of particularly the motor functions, the speech and communication, loss of bodily functions in response to environment. From the start to finish, from someone who's been diagnosed with Alzheimer's, it can take between 5 to 20 years for the disease to progress. And of course, this is an area that we could be praying into for anybody, a relative, a person who's been diagnosed with Alzheimer's, to actually to pray that this, you know, just like was it Elisha or Joshua? Somebody, one of those two people, prayed for time to stand still. Somebody remind me who it was. It's either Joshua or Elisha, one of them. But he prayed for time to stand still, and it did. So we can pray, we can attack this disease with our prayers. We can pray that the progression of Alzheimer's is stopped by the power of the Holy Spirit, and we can pray healing into the lives of those who have the disease. So as I said, there's not a cure at the moment, but there are steps towards prevention, and there are steps towards slowing down the progression of Alzheimer's disease. Now, it depends on different parts of the brain starting to deteriorate, and as I've said, we'll just go through very quickly the 9 stages that show how the progression of Alzheimer's takes place. And this might be something that as a carer you might want to note down, because you might recognize some of the symptoms and signs in one of your relatives or in yourself. So the first kind of stage is the memory loss, and we know that can just be an age-related thing. Whereas as people get older, you know, memory tends to get a little bit but particularly with Alzheimer's, there's a notable change in memory because it affects the part of the brain called the hippocampus. They especially lose short-term memory. And the last time, I remember I quoted 3 objects for you to remember, and most of you were able to quote them back up. In fact, my mum rang me from America and she said, apple, table, penny down the phone. So mum, we know you certainly ain't got Alzheimer's, but you know, that's one of the things you can do to test a relative. Give them some words to remember, and then go about your business, and then 5-10 minutes, get them to repeat what you said. That's a short clue as to whether they may have a memory loss function. So in the first stage is the short-term memory. They forget objects, they forget neurally remembered things, they forget names, they forget, and they ask people the same questions over and over again. The second stage in Alzheimer's is a difficulty in finding the right words to speak or write. This is particularly noticeable in people who have jobs that involve writing or speaking, so it might be noticeable in a head teacher or a teacher or an actor or a writer, an editor of a magazine, that sort of thing. People who write a lot, who speak a lot, may begin to find it difficult to find the right words. They find it difficult to join in conversations. They stop midway in a conversation because they can't remember exactly what they were saying, and they would say, you know, what was I doing? What was I saying? They tend to repeat themselves, and they struggle with vocabulary. And they have problems, as I said, finding the right words. They might call a watch a hand clock instead of a watch. The third stage is difficulty in planning or problem solving. In other words, they have difficulty in actually, for instance, following a recipe from start to finish. They may find difficulty in reading a map or following directions. They might, you know, go onto aaroadmap.com and find difficulty in actually following the directions. Calculating numbers, concentrating, doing puzzles, tasks and things like that. Difficulty in doing familiar things that they once did before, like driving to a familiar location. Suddenly they get lost. They're not able to remember where to go to find a thing. Playing games like Scrabble or those sort of games. Chess, they might find difficulty in actually remembering the rules of the games. They may have difficulty in knowing how to operate gadgets in the home, like using the microwave oven, how to record a program. Things that they once were able to do, they now struggle to actually remember. The fourth stage of Alzheimer's is misplacing things. They may put something down somewhere, and then or they put it in an unusual place, or they put it somewhere and they can't remember, particularly things like keys. You know, they can't remember where they put their keys, where they put their wallet. They can't remember those sort of things. They constantly want to have to retrace their steps, and they're not able to actually retrace their steps to where they might have left the object or whatever. Sometimes they would actually accuse, because they misplace things, they may actually accuse a family member, a carer, a relative, a friend of stealing from them. And, you know, because they don't know where they've put this thing, and that can become a real problem. And I'd like to just say to you carers out there, Please be patient. And you know, there was something, I think Lorna said it this morning, or Gordon, one of the Petties said it this morning. The thing to remember is what they were like before the progression of the Alzheimer's occurred. So it's good. I mean, God has given us modern technology. We've got the ability to take photos. We've got the ability to take videos. Those memories are good anyway, and who knows who's going to get Alzheimer's. So I would encourage you, use your cameras a lot more often. Use your DVD, I mean your video thingies, whatever they're called, a lot more often. We even get them on our mobile phones these days. Use them all, because you don't know when the need for memories will be called on. Memories are good, and when you're caring and you're in close contact with a relative who has Alzheimer's, you notice that the rapid deterioration. It's good for you to be able to look back to what they were like before they start accusing you, before they can't remember you, before they get aggressive and antagonistic towards you. The fourth thing is a personality change. This is where aggression happens, where confusion happens, irritability happens, their personalities change, their moods change, they become very suspicious, they become very aggressive, they're fearful, they're anxious. They become easily upset and fretful. Their moods are very labile. They get confused when they're in places out of their comfort zone and when their routine is changed. And again, that's a clue for carers. It's important that there is a routine that's established and maintained so that they are not confused. The fifth stage is visual changes, difficulty in reading, judging distance, color perception, recognizing even themselves in the mirror. A sixth thing that happens, a poor or reduced judgment, where they have difficulty in making decisions, where they have difficulty in dealing with money. Sometimes they become frivolous and very overgenerous, and they give large amounts of money away. And I certainly know in my experience as a GP, I've had relatives come in and say, my father, my husband, has just emptied the bank account and has just gone and bought about 100 tins of cat food, and we don't even have a cat. Those are the sorts of things that can happen. They can become dangerous on the road, both as pedestrians and as drivers. They let strangers into their home, people they would not normally let into their home. They let people into their home. They pay less attention to their personal hygiene. They begin to find it difficult to cope with personal hygiene, and they become actually unaware that they have this problem. A seventh thing that would happen with Alzheimer's is withdrawal from social activities. They become apathetic. They start to remove themselves from hobbies, social events, sports events. They avoid going to pubs, clubs and parties because of the change in the environment, because it's so difficult for them to remember things and to keep in touch with people and to be able to join in conversations, and because of loss of routine. The eighth thing that would happen is a loss of motor function, and by this stage they're unable to care for themselves. They stop talking, they're unable to swallow properly, they may need to be liquid fed or even peg tube fed. They're not able to get out, so they're bed bound. Bed sores can arise because of that. Chest infections can happen, and these are sort of the last stages of dementia. Of Alzheimer's, and you'll find that unfortunately people do succumb to infections, and this is one of the reasons why they eventually die. Now we're going to watch a clip on the lady whose husband recounts the deterioration in her mental and the rest of the functions due to Alzheimer's disease.
This was, still is to me, Jan. Died on the 22nd of August after probably around about 25 years with dementia, right from the very first sign to her passing gently in her sleep, peacefully. I can think of no more difficult situation than long-term dementia. I really can't. I mean, I've had family members with cancer, I've had family members with heart problems, all sorts of stuff. I can't think of a single thing which is worse than dementia, because with dementia there is no hope. In truth, I'm rejoicing that she's free of it and that she's at peace now. Jan and I were close, really, really close. My mum said, you can't see where Jan stops and Bruce begins, because we were, I can't explain it, we were just so close. We never ever had an argument, not once. At the time when Jan was at the stage of needing it, there was very little help available. So we had We had no respite, we had no people coming in. It was literally just me trying to look after her, plus hold down a full-time job. So many people didn't visit her because they said, we want to remember her as she was. And, oh, God, I'd go mad at that. Because that denies the person as they now are. And they're the same person, for God's sake. It's just this wall comes down which stops them communicating with you and stops them communicating with their own body and stuff. But if you say, well, I want to remember them as they were 20 years ago, then what good's that? Useless. When speech goes, and I think her hearing was a bit dodgy as well. Couldn't tell because you couldn't ask her because she couldn't answer. So you have to find ways of communicating, and increasingly what I was doing was putting my forehead on her forehead, because I think she picked up the vibrations of my voice, because she certainly did respond to that. You would find that you go for months without any obvious response, and then one day you'd say something, just not expecting anything, and she'd say yes. And you think, where did that come from? And you suddenly realise that they're in there all the time. They just haven't got the means of getting out, and what you've got to do is you've got to try and, more than ever, get into their world and try and find some way of making contact. At the end, August the 16th, Jan stopped eating and drinking. I spoke to the GP, and the GP said, I think she's just tired of it all. So it was 6 days later she passed away, but I spent the last days with her all day long, holding her hand, talking to her. And that was the really important point. I had the opportunity to be with her, and it gave me time to say all the things I needed to say to her. In all these things, I'm looking at Jan with dementia, and I want to get back to Jan before dementia. So, and that's already happening. I was on a walk the other day. I like to walk around a little bit, and I got a kind of a sliver of Jan as she was way before dementia came, and so I think she's coming back to me now.
Welcome back to Health in Focus with Dr. Laura. Thank you, Brian. Brian from Stoke, rather, not Stroke. Brian from Stoke has sent an email, and he says, could you say a few words about the difference between benign senescent forgetfulness and dementia, and how to distinguish between the two of them? Brian, it's not so easy, but I tell you what, the first thing is that dementia is progressive. It gets worse and worse. Just age forgetfulness is probably just associated with that particular thing. But with Alzheimer's, there are other factors that begin to play. As I said, there's personality changes as well, and there are other things, risk factors. They begin to become unaware of problems and how to solve them. But there is a very good test, which is called the Mini Mental State Examination, MMSE, and I can actually email you a copy of this, because this is actually actually maybe I shouldn't, because I was just thinking, if somebody was trying to fool their relatives in pretending they don't have dementia, they might read up these test questions and practice them before they go and see their GP. So actually what I would say to you is, if you believe that yourself or relative is in the early stages of dementia, make an appointment to see your GP. But particularly the type of things that will be asked in the mini mental state examination are orientation. The GP will ask you what day it is, what time of the month it is, what year it is, what season it is, what day of the week it is, what is the name of the village we're in, what is the name of the building we're in, what floor are we on. You know, I talked about Apple Table Penny the last time. They would register objects and try and remember them. Attention, subtracting 7 from 100 and 7 from then and 7 from then. Recall, so remembering an object and trying to remember it again. Language, I would show you, the doctor will show you something and say, what is that? And, you know, wristwatch, pen, book, etc. Language, what they call dysarthria. What happens as your speech, the motor part of your speech goes, is that you're not able to say the words properly. So they may give you a tongue twister to say, and if you can't say that properly, and they'll give you a piece of paper and give you instructions, you know, fold the piece of paper with your left hand and put it on your right shoulder or something like that. Those are just clues as to how a patient can be diagnosed with a dementia. And really, there is a score level. If somebody's suffering from, or somebody's in the early stages of dementia, and it's not just age-related, those sort of tasks that I've mentioned, most people as they get older will be able to complete them. But with somebody who's in early stages or moderate stages of dementia would have difficulty actually in completing them. So I would say to you, Brian, the best thing is, if you are not sure, is to make an appointment with your GP and get this mini mental state examination done so that you can have the diagnosis made early. Because in the last program, I showed a clip about a daughter and her mother, and they had lost a bit of time with the diagnosis because the GP had not recognized that the mother had early stages of dementia. So you're watching Dr. Laura. Now I'm going to move on very quickly to prevention and then to talk about carers. Now there are lots of buzzwords that have been going around with prevention of Alzheimer's. Coconut oil is one of them, ginkgo biloba, omega-3, coenzyme QA. These are all buzzwords, and of course now we know about statins as well. And these are all buzzwords that have been mentioned regarding Alzheimer's disease. And what I'd like to say is some of them are myths at this point, some of them have not been proven at this point, and some of them are sort of equivocal. The first thing to say is that caprylic acid, which is a byproduct, it's a medium chain triglyceride, and it is a byproduct of coconut oil or palm kernel oil, has been shown. So there is a lot of truth in coconut oil. It has been shown to provide a different pathway in the brain cells by the formation of what they call, by the breakdown of these things called ketone bodies. And this has actually been shown to help to slow down the progression of Alzheimer's disease. So there is evidence that coconut oil, or the byproduct called caprylic acid, does actually help in the prevention of Alzheimer's disease. So go and get your coconut oil, okay? It does seem to be a good thing to take. And imaging studies have actually shown that people who start to take a good supplement, and it has to be a good product because there are lots of counterfeits out there. If you want some details, do email me at laura@revelationtv.com and I will send you some details on the coconut oil products. But coconut oil definitely gets the thumbs up with research, because it has been shown that people who start to take coconut oil, people who've been diagnosed with dementia, when they start to take these coconut oil byproducts, caprylic acid, actually show an improvement and a decline in the progression of Alzheimer's disease and the progression of the brain patterns. This has been shown scientifically. Buzzwords like coenzyme Q10 or ubiquinone is the other name for it. No evidence has been found that it is effective in treating or preventing Alzheimer's disease. Of course, coenzyme Q10 has got very good uses actually, but it hasn't been shown to have any benefit in Alzheimer's disease. Neither has ginkgo biloba. Ginkgo biloba has not been shown to have any positive benefit in Alzheimer's disease. So I'm afraid ginkgo biloba, coconut, and what was the other one? Coenzyme Q10 don't seem to have any effect in slowing down Alzheimer's disease. But omega-3s, again, and you'll find this in fish oils particularly. Fish is good for you, whichever way you look. Fish is good for you. Omega-3 fatty acids have actually been shown to reduce the risk of developing dementia or cognitive change. So the take-home message today is coconut oil gets the thumbs up, so does oily fish. Now, a quick word for the carers. Carers, there's an Alzheimer's Society. The number is 0845 300 0336. It's an Alzheimer's or dementia helpline for carers. And tips for carers, I'll just read that number out again, 0845 300 0336. Also go onto the Alzheimer's Society website as well. Tips for carers, very quickly. Help your loved one to feel valued. Be flexible, be tolerant, be patient. Act with courtesy. Remember who they were and not who they've become. Be kind, be reassuring to them. Include them in conversations. Avoid scolding or criticizing them. Respect their privacy. Just because they've lost the perception and because they've lost the sense of rightness and what's proper, do not treat them like children. Give them the right respect and give them the right privacy. If they need help with intimate personal activities like washing, etc., make sure you do it in a private place. Offer them choices. Sometimes they just need choices. Sometimes they need you to help them to remember things. For instance, if their son walks into the room, don't say, "Who is that?" Say, "Is this your son? Is this your nephew? Is this your dad?" Give them choices so that they can recall, give them help to recall things. Privacy, patience is very important when dealing with people with Alzheimer's. Thank you so much for watching Revelation TV and Health in Focus today. This is the last episode on Alzheimer's, I'm afraid, but I hope I've helped you to understand the condition a little better. I hope I've offered the carers some insight as to how to deal with patients who have Alzheimer's. There is one last clip I'd like to show. I don't know if we've got time. Have we got time, folks? We don't have time. That's a shame. But there is a clip on carers and what to do, but that's fine. I hope I've given you enough tips. If you have any queries, please do not hesitate to email me at Laura@Revelation TV. Brian says, thanks, Dr. Laura. I think you have reassured me because he's got dementia, not the other way.